social participation and inclusion, and including supports. Inclusion supports active aging.
It does actually, because you think of somebody with a mental health disorder, if they're quite isolated, I think when they talk about it to somebody else or they're involved in group activities that takes them out of themselves, that would certainly promote their well-being better, and then obviously would improve their mental health. I mean, that's been seen in a number of things, like exercise, for example. Walking is great, swimming. I suppose, well, I see that, I know again I'm preempting, I'm having a look at your questions here. Could you give an example of how something, how services supports them? I suppose they do establish links, and again, this will be unit by unit based with their local community groups. And I know certainly during lockdown there has been a certain exercise instructors carrying out Zoom programs for clients and things like that. And I think the day service staff within the organisation, and as well as the regular residents, are very, very good for doing that.
Great.
Again, done by the basis. The whole over it be the same for all units, and then obviously this. I think that's what the organisation needs to really improve in, to have joined up thinking, so we're all approaching the same problem, the same way.
Okay, that's fair enough. Thank you for that. And then just the last kind of 3 questions there. Do you think Sunbeam House Services provide enough information and planning to meet its aging resident needs in timely manner? So again, we kind of stumbled upon it there earlier, but
I think again that's an area that has to be improved, because I think we do a lot of firefighting. Because as I said before, if the client's condition can be preempted, those supports could be put in place to make it easier for staff to carry out evidence-based care, and then obviously for the client themselves to enjoy a better quality of life. So I think that's something that is a work in progress. It's certainly something that can be improved.
Yes.
Again, I think it's something that's going to be expanded upon, especially with dementia care and end-of-life care.
Yes.
And I suppose just to add on to that, David, I have sought funding for the KIOL program to be brought into Sunbeam through one of the Nursing and Midwifery Development Unit. Now, I'm waiting for that. I've sent in the application for this year, and I'm hoping to carry out the KIOL program on a pilot basis in one of the units. And if that is successful, maybe going forward that this will be rolled out into all units where staff are educated on this, and then to be able to carry out more evidence-based care.
Great. So that's some positive. And just maybe I ask on that, I ask an additional question. Just I was thinking about the role that some of our staff nursing have, and potentially the usage of the knowledge that some of our staff nurses have in some locations. Maybe this could be somehow be used more than it is now. I don't know. Just kind of thinking.
I suppose it could be. Yeah. Again, as an organisation, that's one thing I strive to do within my own role, is to get more education out to staff and to inform staff. So I think nurses could, it could be a good action. Now, there is a new role where they have to become involved in that type of thing.
Okay.
So I think again, that's I'm only one person, I'm one resource, but we need more resources in regards to that, more health promotion. And I think maybe if there was a designated, like the way there's a designated officer for HICWA.
Yes.
If there was a designated staff member for health promotion in each unit, and it doesn't necessarily have to be nursing staff, because the majority of our staff are social care staff.
Exactly,
and
yes.
we're all part of the same team.
Yes.
So, I mean, the potential of social care staff is just the same as the potential of nursing staff.
Okay.
So I wouldn't see a difference in that, because we are all part of one team. We're all here for the benefit of the time.
Of course, yes.
The good of the time.
Great, that's a really good point there. So then this is coming up the last third question. What do you think is the biggest challenge in meeting aging residents' growing needs? This can be both externally and internally. So externally, like anything ranging from funding, public engagement, and internally, as we already kind of spoke about, policies and
funding will be a big issue.
Yeah.
That's internally, but it could be also externally to get those external courses done. And I suppose staff numbers.
Mm-hmm.
Okay. Again, I'm a clinical trainer for a whole organisation. If you look, I know we have the multidisciplinary team, but if you look at some other organisations, they would have 3, 4, 5 people that would be maybe designated to certain clusters of houses.
Yes.
And they would be able to be more actively involved. I think it's very, very hard as an intellectual disability organisation. We're sort of at the bottom of the queue.
Mm-hmm.
We're more than the mental health services.
That's a good point, yeah.
I think the GPs, I think there could be more maybe engagement with the GPs, that they need to understand where we're coming from,
mm-hmm.
because I think there is isolation there. And I think communication could be, and maybe guidelines around attending the GP, accessing those services. So I think a lot of that work needs to be done as well. Internally, I wouldn't say staff would be opposition, because there's a lot of very, very good staff that are very, very enthusiastic about the job. The care is second to none. But I think it's financial, it's resources, and again, it's establishing those links with the GP services, with the public health nurse, with the various organisations.
Great.
So.
Fine. Okay, and then just the last question there. Based on your experience, can you provide any recommendation to Sunbeam House Services on how they could make Sunbeam House more aging friendly?
Yeah, I think maybe an education or an online education piece around aging
mm-hmm.
and the different conditions, and then maybe just widening staff knowledge of the services that are out there, and again getting access to those services. So I think the links really do have to be established between our organisation and the other organisations that are out there, because not that there's a lot of ignorance, but there's a lack of awareness of actually what is out there. But that's not our fault as an organisation, but it's beginning to have that conversation, think about going forward, and think what are we going to do in the future with clients that 10, 15, even 5, 10, 15 years down the line could be in where they have dementia, they've had a stroke, or whatever else, and what comforts, what care, proper care should we provide, and then how do we access that care and access those services, and make it like not on an isolation basis, but continual, and grow that as we're going forward.
Great, that's okay, and that's brilliant. So that will kind of conclude the questionnaire I had there for yourself, Frank. So thank you very much for that.
No problem.
And I just maybe have one more question. Just it's little bit. It's based on the information I gathered from other people and the literature, and both the Irish government attitude towards. Although there is a push for awareness of aging clients and our population, but there seems to be like maybe
hesitancy
or a stigmatization of almost boxing people. For example, as in our services. It's almost from both funding I'm comparing the nursing homes into our homes. It appears there's the government, although it's promoting, but it's not seeing our organisation as a possibility of identifying those needs at the really early stages. And there's appeared to be focus on nursing, both from funding and different development